are the different types of dementia found in India? When a loved one receives a diagnosis of dementia, it signifies a presence of a progressive and often chronic brain condition that affects their memory, thinking, and behavior. Dementia is not a specific disease but rather a syndrome encompassing a range of symptoms associated with various brain diseases. With time, the condition worsens, but certain medications may help slow the decline and alleviate some behavioral changes. In India, like other parts of the world, several types of dementia can be observed, each with its unique characteristics and treatment approaches. Alzheimer's disease. Considered the most common type of dementia, experts estimate that 60% to 80% of individuals diagnosed with dementia have Alzheimer's disease. In the United States alone, over 5 billion people have received that diagnosis. Common symptoms associated with Alzheimer's include memory loss, difficulty with planning and executing familiar tasks, confusion regarding time or place, problems with language and writing, and changes in mood and personality. The symptoms start mildly but progressively worsen over several years. Vascular dementia is typically the result of a major stroke or multiple smaller silent strokes that may go unnoticed by the affected individual. Symptoms vary based on the area of the brain affected by the stroke. Unlike Alzheimer's, vascular dementia often begins with a poor judgment, difficulty in planning, organizing, and decision making. Additional symptoms include disrupted memory, affecting daily life, speech and comprehension problems, impaired recognition of familiar sights and sounds, confusion, agitation, mood changes, and difficulties with walking and balance. Dementia with Lewy bodies, DLB. DLB is characterized by the presence of microscopic protein deposits called Lewy bodies in the cortex of the brain. Symptoms associated with DLB include impaired thinking, memory problems, visual hallucinations, excessive daytime sleepiness, blanking out episodes, movement issues such as trembling, slowness, and difficulties in walking, and physical acting out during dreams. Parkinson's disease dementia, PDD. Around 50% to 80% of individuals with Parkinson's disease eventually develop a Parkinson's disease dementia. Dementia symptoms typically emerge approximately 10 years after the onset of Parkinson's. PDD shares similarities with DLB, including the presence of Lewy bodies in the brain. Symptoms include cognitive impairments, memory difficulties, problems with attention and decision making, visual hallucinations, sleep disturbances, and motor issues. Frontotemporal dementia, FTD. FTD occurs due to cell damage in specific brain regions controlling planning, judgment, emotions, speech, and movement. Common symptoms of FTD include personality and behavior changes, lack of inhibitions, language difficulties, and movement problems like shakiness, balance issues, and muscle spasms. Huntington's disease. Huntington's disease is a genetic disorder passed down through families. While the gene for Huntington's is present at birth, symptoms typically manifest between the ages of 30 and 50. The cognitive impairments associated with Huntington's disease include problems with thinking, reasoning, memory, judgment, planning, organizing, and concentration. CJD is a rare condition caused by prion proteins that include the folding of normal brain proteins into abnormal shapes, resulting in rapid onset and deteriorating dementia symptoms. Affected individuals may experience memory and concentration problems, poor judgment, confusion, mood swings, depression, sleep disturbances, twitching or jerky muscles, and trouble with motor skills. Normal pressure hydrocephalus, NPH. NPH occurs due to an accumulation of fluid in the brain. Symptoms of NPH include difficulties with walking, problem with thinking and concentration, and changes in personality and behavior. Some symptoms can be alleviated by draining the excess fluid from the brain using a shunt. Wernicke-Korsakoff syndrome is caused by a severe deficiency of thiamine, vitamin B1, often observed in long-term heavy drinkers. The most common dementia symptom associated with this syndrome is memory impairment, while problem-solving skills and thinking abilities typically remain intact. Conclusion: dementia encompasses several types, each presenting its unique characteristics and progression. Recognizing the different forms of dementia is crucial in providing appropriate care and support to the individual affected by these conditions. With advances in research and healthcare, it is hoped that further understanding and effective treatments will emerge to improve the quality of life for those living with dementia in India and worldwide.